China is dealing with a new health problem as cases of a virus called human metapneumovirus, or HMPV, are increasing quickly. This virus, which was first identified in 2001, is now causing significant concern among health officials and the general public alike. This is happening at the same time as other viruses like the flu and COVID-19 are also spreading. The simultaneous spread of multiple viruses is putting a tremendous strain on healthcare systems, making it difficult for hospitals to manage the influx of patients. HMPV is a common virus that usually causes mild cold-like symptoms. These symptoms can include a runny nose, cough, and fever, which are often mistaken for other respiratory illnesses, but it can be serious for young children, older people, and those with weak immune systems. In severe cases, it can lead to pneumonia or bronchiolitis, requiring hospitalization and intensive care. There are reports on social media of hospitals being very busy with patients and even some crematoriums being overwhelmed. These reports highlight the severity of the situation and the urgent need for effective public health measures. There are even claims that China has declared a state of emergency, though this has not been confirmed. While these reports are concerning, it's important to wait for official information. Misinformation can spread quickly, causing unnecessary panic and confusion among the public. Chinese health officials are watching the situation closely. They are working around the clock to monitor the spread of the virus and implement necessary measures to control the outbreak. They have a new system to keep track of pneumonia cases that they don't know the cause of. This advanced tracking system allows for real-time data collection and analysis, helping to identify patterns and potential outbreaks more quickly. This will help them understand how big the outbreak is and how to respond. By having accurate and up-to-date information, health officials can make informed decisions on how to allocate resources and protect the public. The recent increase in HMPV cases in China is something to be concerned about. However, it's also a reminder of the importance of good hygiene practices, such as regular hand washing and wearing masks, to prevent the spread of respiratory viruses. But it's important to remember that respiratory viruses are common, especially in the winter. Staying informed and following public health advice can help reduce the risk of infection and keep communities safe. HMPV often looks like a common cold, making it hard to tell apart from other respiratory illnesses. This means you might have a cough, runny nose, stuffy nose, and fever. These symptoms are very common and can be quite uncomfortable. Some people might also have a sore throat, feel sick to their stomach, throw up, or have diarrhea. These additional symptoms can make the illness more severe and harder to manage. These symptoms usually last for a few days, but they can sometimes get worse and lead to more serious problems like bronchitis or pneumonia. It's important to monitor your symptoms and seek medical attention if they worsen. HMPV spreads when someone who is sick coughs or sneezes. This is why it's crucial to cover your mouth and nose when you cough or sneeze. This releases tiny droplets in the air that have the virus in them. These droplets can travel through the air and infect others nearby. You can get infected if you breathe in these droplets or touch something they landed on, like a doorknob or toys. Always wash your hands and avoid touching your face to reduce the risk of infection. Right now, there is no specific medicine to treat HMPV. Unlike COVID-19, there isn't antiviral therapy or a vaccine to treat HMPV. This means doctors focus on treating the symptoms and making you feel better. Over-the-counter medicines for pain and fever like acetaminophen or ibuprofen can help. Decongestants can help clear a stuffy nose, and inhalers might be prescribed if you're having trouble breathing. Sometimes nasal sprays with corticosteroids are used to reduce inflammation. Rest and drinking plenty of fluids are also very important for recovery. While both HMPV and COVID-19 are respiratory illnesses and can look similar, there are some important differences. Understanding these differences is crucial for proper diagnosis and treatment. Unlike HMPV, there are effective antiviral treatments and vaccines for COVID-19. These medical advancements have significantly reduced the severity and spread of COVID-19, making it more manageable. Also, COVID-19 can spread year-round, affecting people in all seasons, but HMPV is usually only common in the winter and spring. This seasonal pattern helps in anticipating and preparing for HMPV outbreaks. Although both viruses can make people very sick, HMPV is generally considered less serious than COVID-19. COVID-19 has been associated with higher rates of severe illness and complications, especially in vulnerable populations. It is important to know these differences and talk to a doctor for the right diagnosis and treatment. Consulting with healthcare professionals ensures that you receive the most appropriate care based on your specific symptoms and health condition. Thanks for watching. Share to care and spread maximum awareness. Reset health, reset life. Be with Channel Health and Alerts to remain up to date on health parameters.